Welcome, everyone. We are so happy to have you joining us today for this webinar titled Using Biofeedback for Better Breathing Outcomes. I'm Dave Sen with ACP, and the theme of today's webinar is something that is essential to all life functions, breathing. We will cover how respiratory rehabilitation has been transformed by the Omniflow, our new engaging and easy to use biofeedback breathing exercise system. It's an absolute pleasure to have three fantastic clinical experts featured today who will speak to the impact of Omniflow on treatment planning, the patient experience, and community outcomes. Educating us today will be Valerie Middleton, our very own speech-language pathology clinical program consultant, Amanda Lee, a SLP with Lighthouse Therapy and Rehabilitation at Singing River in Gulfport, Mississippi, and her fellow SLP colleague there, Amber Sullivan. We are thankful to have our partners from Lighthouse Therapy, so please let me offer you a short introduction to their organization. Lighthouse Therapy is owned and operated by local professionals, which keeps their focus aligned with the community's needs. They understand the importance of providing high quality PT, OT, and SLP care to post-acute facilities in order to help patients heal the body, build their confidence and spirit, and reach their highest level of independence. Lighthouse Therapy at Singing River in Gulfport, Mississippi is the only provider in the area utilizing Omniflow. Briefly, for those who are new to ACP, we are a clinical solutions company that services the national footprint across the continuum of care. ACP offers rehab technologies and evidence-based clinical services provided by our team of licensed consultants like Valerie. We are committed to helping our partners provide outstanding healthcare value, all in the name of improved patient outcomes. Now, enough from me, I need a breather. So let me hand it off to Valerie for a recorded demo that will give you a great idea of Omniflow's capabilities.
Thank you for joining us today, and I'm excited to share with you for the next few minutes about one of ACP's newest technologies of the Omniflow Breathing Therapy Biofeedback System. As you see pictured here, and as I'm going to walk us through during demonstration for the next few moments, this is our virtual reality breathing exercise program that consists of our airflow sensor and our touchscreen laptop. The airflow sensor is plugged in via USB port to the laptop so that as the patient's completing inspiration and expiration exercises, the data is collected and transmitted onto the software so that on the screen, the clinician and the patient can simultaneously view how the patient's completing an exercise, what the target level is, and if they're achieving that target level. The clinician's able to go in and, as you'll see in a few moments, manipulate these parameters to find the right therapeutic threshold for that patient, and also to provide engaging exercises, as you see pictured here, such as our diamond mine, to keep that patient participating and understanding if they are reaching their goals. This can be for deep inhalation, forced expiratory volume, and rhythmical breathing to combine both inhalation and exhalation. And at the end, as you see featured here, and as we'll talk about during our demo, the clinician and the patient will receive outcome data that can be helpful to review with the patient so that they know where they are in their plan of care and in their progress. In addition, that clinician is able to document these outcome measures to be maybe more objective than what we would have in our documentation without the use of biofeedback. Two things that really stand out that make the Omniflow breathing therapy system different is the fact that it does have this biofeedback capability in conjunction with the fact that it's a virtual reality animation feedback. Also, the fact that we can use both inhalation and exhalation exercises, while many tools out there will only allow you to focus on one or the other. We know from decades of research that biofeedback is very helpful in motor learning, and that's no exception with breathing therapy. We see, especially in studies that use virtual reality biofeedback, that those patients participate at higher levels and in higher intensity in their therapy sessions, helping them to achieve their outcomes quicker. I'm going to begin today with our demo showing the diamond mine, or our deep inhalation exercise. This is used to improve inspiratory muscle power and inspiratory vital capacity. We're going to instruct the patient to breathe in slow and steady. As the patient attempts to breathe in a preset air volume in one breath, the inhalation is displayed as a vacuum cleaner collecting jewels and coins. A large diamond is collected for reaching the very far end target. This deep inhalation may facilitate improved diaphragmatic breathing, improved lung elasticity and volume, leading to increased muscle endurance required for proper function, self-care, respiratory swallowing coordination, and sustained speech production of words and phrases. As you see here, we have preset levels of easy, moderate, and hard, or we can customize. The challenge levels increase with the volume, how much air is expected, in this case, to be inhaled. We have the same option though for our exhalation exercises. Additionally, how many repetitions and how many sets of repetitions increases the challenge. Not shown today is a pre-exercise warm-up the patient can complete to get these specific target values. They range from 1 to 25. We can also go in and customize for any of our exercises or edit parameters to go through and adjust some of these parameters such as volume, flow, number of sets, number of repetitions, and rest period between repetitions. For our purposes today, I'm going to select easy. So we do get feedback automatically for our percentage. And this is an example of getting all of the coins and jewels in one breath. We'll do that again. Now, if I were to not have enough volume or were to not have a good lip seal over the mouthpiece, it may look more like this. Right, and it kind of times out and it shows that we just got right over 50% of accuracy that time. That percentage is great for our patients to see, but we also get more objective outcome data here that our clinicians can use for their documentation. So we can see the best inspiratory volume level, also the average inspiratory volume level. We also can see this per breath or per repetition for the volume and flow levels. And then our loops, our flow volume loops, where across the x-axis we have our volume and across the y-axis we have our flow. And we can see with breath 1 and 2, where I completed this very timely in one breath with a good amount of air, that it stretches pretty far across the x-axis, it goes pretty deep on the y-axis, versus breath 3, where we have that deep, but we don't have the full air here, we don't have the full volume, and so it does not stretch across the x-axis very far. This is something that the clinician can use as a teaching point for the patient. Now I'm going to show you our prehistoric contest for forced expiration. And this is to improve expiratory muscle power. We would instruct the patient to take a deep breath and exhale as hard and as fast as you can. As the patient attempts to breathe out a preset air volume, again in one breath, the exhalation is displayed as a prehistoric javelin being thrown. The more forceful the exhalation, the farther the javelin travels, and the larger the size of the prehistoric animal that's rewarded as a prize. If the preset target value is exceeded, a mammoth is the reward. This forced expiration exercise can help with airway protection during swallowing, coughing, clearing the airway, and execution of adequate vocal intensity and phonation. We see again here that we have an easy, moderate, and hard preset level, or we can customize. This exercise is essentially an FEV1, or forced expiratory volume over 1 second. We'll go to our moderate level this time. Okay, so an example of getting to the farthest target and getting the woolly mammoth. We'll try that again. Okay. So this time I'll provide an example of not giving enough exhalation volume. Okay, so similarly to our diamond mine, we get the best expiratory flow and average expiratory flow here for the clinician to document and to show to the patient. Also the outcomes for repetition and our loops. So we can see the first couple of breaths had these nice big full loops, and that's what we would want our patient to shoot for. Now I'm going to go into our sail away exercise, which is similar to our prehistoric contest, but this is more about controlled expiratory volume and flow. Instead of one quick blast of air, we're going to sustain that duration. We're going to have the patient to be represented as a cloud. As the patient attempts to breathe out a preset air volume, the exhalation is displayed as wind moving the sailboat forward across the water. The patient must control expiratory volume and flow in this case, not just flow. Once patient reaches 100% of the target volume, the boat's going to arrive at a grassy island. For this exercise, it can help with expelling carbon dioxide, reducing dyspnea, helping to have a calming effect for those with anxiety and pain. It can improve eccentric control of the diaphragm to slow the pace of breathing and also retrain sustained phonation, vocal intensity, and speech intelligibility. Again, we have our preset thresholds here. I'm going to go with our easy to showcase this today. An example of getting to the target. You probably see right below the cloud there is this kind of air meter where it shows if I have too much air, it's going to turn red and it's going to be at the end of this meter. If I'm keeping it slow and steady, it will go to about the middle and in the green to yellow. And if I don't have enough, it will be at the very beginning. You'll see some of that. I'll try another good one here. It stayed in the green. Now let's say that I provide too forceful of an exhalation. It goes to the end, you get that exclamation mark, and it also breaks the sail, as you see here. Versus if maybe I don't have enough volume. Okay, we only got to the 25% buoy there. Now we get this outcome measurement. It's a little bit different from some of the ones we've seen previously. We can see how many times the patient achieved the goal. We had 5 repetitions. Out of that, there were 3 times that it was achieved. We also get a percentage, 72% of the time the target volume out of 5 attempts was achieved. Had 1 time that we exhaled too hard and 1 time that it was too low with the volume. Similarly, though, we still get these outcome measurements that our clinician can use for exhalation. I'm going to take us to Starry Road now. For this particular exercise, it is very unique in the fact that it combines both inhalation and exhalation for our rhythmical breathing. As the patient breathes in, the figurine in the picture is going to move up this Starry Road path, and as they breathe out, she's going to move down. Again, we have these preset levels of easy, moderate, and hard. But additional to being able to change the target volume level, we also can change the duration, the timing for the inhalation and exhalation. That is going to make a difference for our path slope. So how steep the slope is going to be determined upon this duration. The steeper the slope, the easier, because less time that's required for inhalation and exhalation. And the more gentle the slope, the harder. And we can customize to change maybe just inhalation or just exhalation. Again, this can be great for expelling carbon dioxide. It can be great for working on respiratory swallow coordination, and it can be great for reducing overall anxiety and pain. So again, the goal is to breathe in very steadily so that we stay on this path. But if I have very shallow breathing, maybe just kind of that blast of air in and out without having good control. It may look like this. Right, so we're not able to stay on the path and we're not getting as much of the stars. And that will provide an actual percentage of conformity for how well we stayed on the path. We see that in the upper right-hand corner. We also see it here and in our outcome measures. So here's that percentage. I started really well. I was at 100% for a while, and then I purposefully showed you what it may look like if the patient gets off the path. So we're at 82% accuracy. Something that is unique about this particular exercise is that it's an adaptive pathway. So if the patient does score at a 90% or above, actually increases the challenge for how much duration is required, versus if they don't even get to a 60% accuracy, it will decrease that challenge for the patient. And just to show you the loops very briefly, here we can see both the inhalation and exhalation, so it's on the positive and negative side of the graph. Breath 1, 2, and 3 look very good, very symmetrical, low to the x-axis, versus at 4 and 5, where it's just, again, that shallow, quick breath of air. Lastly, I'm going to show you our dandelion exercise. This is our active cycles of breathing therapy that is going to go through proper breathing technique, thoracic expansion, and our huff technique. Again, this can be great for helping to protect the airway, helping to expel foreign objects, phlegm, secretions from the airway with that huff technique. And as the patient is going through each of these 3 active cycles of breathing, they can choose to move forward or backwards to repeat any of the portions of this exercise. And their breathing will be represented by this dandelion, and we'll talk about what that looks like as we go through. It's from the breathing control, really working at the level of good diaphragmatic breathing. And as you see, we're just going to simply breathe in and out gently for 10 to 20 seconds. This does not time out though, so you can have your patient complete this for longer. And we're just going to see the dandelion sway back and forth. So if I'm having proper breathing back and forth, it's going to move accordingly, versus if I'm doing this, again, with those shallow breaths. Right, it's not really going to bend the dandelion back and forth completely, and we do want to see that flexion. So that could be a teaching point for your patient. Now to advance, I just go to the bottom right-hand corner to start thoracic expansion. And as we can see here, we're going to ask the patient to take a deep breath in, hold that inspiratory volume for about 2 to 3 seconds, and then breathe out slowly and steadily for 3 times. So we'll try that. Similar look here, but there's more focus on really having the patient have sustained expiration. Now, again, if the patient didn't get good inhalation or expiration, it may look a little different. Right, we don't see the dandelion completely flex, right? It kind of stops midline. And this is what would happen if the patient was not completely releasing that carbon dioxide, not having a good, full, sustained exhalation. Now we can look at our huff technique. We do get 3 repetitions for this. And the goal would be for the patient to breathe in deeply and to huff into the airflow sensor. There is a button here that if the patient coughs instead, that we can throw that trial out and restart. But if I am successful, we will see the seeds of the dandelion disperse from the stem. Okay, we got that one. Okay, an example of where we did not do a proper huff technique. It did not release. And here we're able to have new growth because we had, proper spreading of the seeds with the dandelion. Again, we're going to see outcome measurements really based on just the expiratory flow level. So this is picked up from the Huff technique, and we can go through and see all of the information, including our flow volume loops.
Now transition to Amanda and Amber from Lighthouse Therapy. Thank you so much, ladies, for joining us, and I'll go ahead and turn it over to you.
Yeah, thank you for having us today.
Thank you.
I'm Mandy.
I'm Amber, and we're the speech therapist here at Singing River Gulfport with Lighthouse Therapy.
So yeah, a little bit about our facility. It is kind of unique because we are a skilled nursing facility, but we're located on the top floor of a hospital. So it seems like we sometimes get some more of those acutely ill patients. And I remember when ACP first introduced the OmniFlow to us, we were just thinking, okay, this is going to be great to be able to implement with some of these people. So speaking of benefits, of course, it is really portable. It's really easy to set up. We just have the laptop, the sensor, and then a spiret to take room to room with us. And as long as you can have, the bedside table or the patient's countertop, a small area to be able to set up and then use it there. It's easy to clean, which is really important right now with infection control. So we're just able to wipe it down between rooms and take it with us. And then as far as our collaboration with our therapy team, it has improved that with our PT and OT. Of course, if we as speech therapists are implementing the OmniFlow in our treatment, we may be working on speech production or swallowing, but it's helping build that breath support and that respiration coordination. So then it helps them with their walking, with their endurance, with physical therapy, or their stamina when they're doing their daily tasks. The impact that it's kind of had on our treatment, when we go in to see a person and we think they'll benefit from OmniFlow, we have to first make sure that they're going to be cognitively appropriate to use the device, just making sure they can follow the directions and pay attention to what's going on the screen, being able to visualize the screen. And then once we've established that, we've noticed that it is really engaging, just having that visual feedback, having that biofeedback with it. When we go in as SLPs and we are doing our initial evaluations, if that's a cognitive evaluation, you can kind of assess their speech production within conversation with you. If you're noticing that they're having to stop and breathe every 2 to 3 words, or that they can't get through a conversation, then you can kind of get that informal assessment with their speech production and respiratory coordination there. Or if you can measure a max phonation time with them, you can use that in your initial assessment and use that to build your goals with OmniFlow in your treatment. As far as swallowing treatment, if you have the instrumental evaluation on hand, you can build from that. Or, if you're fortunate enough to be in a facility where you can get an instrumental evaluation quickly, use that information. But just with your bedside swallow eval, you want to assess, how much is this person able to eat before they're really fatigued? Are they taking breaks to breathe? If they're on supplemental O2, you want to maybe take a reading with the O2 on. And then if they're comfortable, get a reading with their O2 off, just to have that measurement at baseline. And then, are they getting this cough production, airway clearance, that kind of thing? And then you can build your goals from there. So in our practice, you can see there's just a few examples of some goals you can work from there. One of the patients that I like to talk about a lot, who's been a really great, he's benefited a lot from this program. He came to us on 5 liters of oxygen. He was post-COVID with pneumonia, had a lot of anxiety with breathing. So he didn't have that good cough production. He had a very weak throat clear. So we incorporated the OmniFlow from the start of his therapy, and by discharge, he was able to do that good hard throat clear, get that airway clearance going. He also had really decreased intake. with his meals. He wasn't able to even eat 25% of a meal before he just felt really tired. It wasn't that he wasn't hungry or didn't have an appetite. He just physically could not eat anymore because he was so tired. So again, using the OmniFlow in our treatment, we were able to get him to where he could eat 100% of a meal and more. And then with the reduced anxiety, you know, a lot of times we get these patients who have this respiratory compromise, and, you know, throughout their patient for this long extended period of time, they've been told to focus on their breathing. So that's really all they can think about. And so you present any other kind of treatment task to them, whether that's a meal or something with, you know, their other therapies, and that can be really overwhelming. So with the OmniFlow, you can kind of meet them where they are. If they are more comfortable starting in the bed, then you can start in the bed. Just, you know, elevate the head of bed and show them that, hey, this is something we can incorporate that's fun, and show them they're capable of doing it. And that kind of builds their confidence and boosts their spirits a little bit. As far as the supplemental oxygen, we have seen a lot of success weaning down the supplemental oxygen. And then the gentleman that I brought up earlier, he actually, as I said, started on 5 liters and discharged home on room air. So it's just the most rewarding feeling to be able to help a person get to that point. And he actually came back to visit us after he went home, and he wrote us all a little note, and he said, you know, my O2 sats are at 96% and above. So, you know, you've done something right when a patient's still monitoring their O2 sats at home. And then, of course, the better breath control for speech and voice. So we had a patient come to us, and he was only able to say about 2 to 3 words before he had to pause and take a breath. And that just wasn't functional for him. You know, he couldn't have a phone conversation or have a conversation with family comfortably. So we implemented OmniFlow within his treatment, and by discharge, he was having full conversations with us. So it is very rewarding and very beneficial to these patients.
Absolutely. Okay. So after we've completed our initial speech evaluation, and there's nothing really that the patient can benefit from speech therapy, we go and we communicate with the occupational therapist the day of their initial evaluation, and we just kind of give them a heads up, like, hey, we think this patient can really benefit from using the OmniFlow. So some feedback that we kind of put together is we found patients are more receptive to respiratory exercises when they can visualize their efforts. We have experienced success in using OmniFlow with patients post-COVID for O2 weaning and building endurance, as well as with patients diagnosed with COPD for increasing respiratory control and coordination. And our OT member that we get to work with, here's some of her feedback. She stated that OmniFlow has greatly improved our patients' performance during functional transfers, ADL and IADL tasks, especially those requiring increased effort and time and prolonged functional mobility. This program gives the patient control and understanding to improve their respiratory function, providing the ability to complete their desired daily task. Additionally, the OmniFlow is broken down into inhalation, expiration, and rhythmic breathing interventions, making it easy to focus on the patient's specific goals for respiratory rehab. So here are some things that we personally like about the OmniFlow. The process for tracking data is super easy and beneficial. You can actually log into the patient's chart, look at their history, and compare their past history with their current data from that treatment session. So that's super beneficial and easy to keep up with the patient's progress as we're working along each day. Something else that we like is it keeps the therapy sessions fun. The patients are super engaged in it and they really do enjoy it. We've had several patients describe it as a game, so it's really fun. They really enjoy it, so it gets them participating really well. A lot of the patients have reported to us that they enjoy being able to visualize their progress. They like the biofeedback aspect of it. A lot of them have stated it's like they are their own competition. So they really enjoy that. And we both personally have really enjoyed seeing our patients who come in who have COPD progress during the exhalation interventions and work their way up to each level. So that's been really cool for us to see them make those progresses. And you can also go in, as Valerie was saying, and you can edit the parameters. So say that your patient is having a rough day, they're feeling lethargic, you can actually go in and change how many sets and repetitions the patient can do that day to where they're still participating in therapy and still getting the OmniFlow therapy that day, just maybe not as many sets and repetitions for the day. And say that they're having a really good day, you can always up the sets and reps. So we like how you can edit the sets and reps on that. We don't use this directly as a cognition treatment. However, it indirectly improves cognition, such as auditory comprehension, such as following directions, and sustaining attention. We actually have a patient on caseload right now who came in with terrible anxiety, COPD, and really decreased attention. And since utilizing the OmniFlow during his treatment sessions, he's greatly benefited from sustaining his attention and being able to follow directions. And I think a lot of that comes from him just really being engaged and really enjoying the OmniFlow. So let me move this. Some feedback from some of our past patients that we've had. One of our patients who was being treated for dysphagia therapy gave us some feedback stating, during the month I spent in rehab, my speech therapist used the OmniFlow to build up my lung capacity and breath control. Eventually, I could see steady improvement in my breathing. OmniFlow was a great addition to my rehab process. And one of our patients who was being treated for speech gave us some feedback, and she stated, I enjoyed participating in the OmniFlow as it reminded me of a game and it was more engaging than traditional therapy. So as we've stated, our patients have really enjoyed this, and it really helps make therapy fun for them and really gets them participating. We have a lady on caseload right now who loves it. She wants to take it home with her so she can compete with her grandson. And she states that it's user-friendly while also being a good challenge. And it's just very useful, and SLPs can really utilize this too to switch up their traditional therapy sessions. And as Valerie said, it's just another tool in our toolbox. So we really enjoy the OmniFlow and think it's very, very beneficial.
Ladies, that was awesome. Thanks so much for sharing. And before I know you just went on mute, but before you stay on mute, one thing I wanted to follow up on there, I know you mentioned that you collaborate a lot with OT, they're trained in OmniFlow as well. Although SLP does a phenomenal job with this, it's great because it's interdisciplinary, right? OT, PT, even nursing can use this. So I noticed that you mentioned you kind of have side conversations sometimes with the OT. Hey, we evaluated this person, here's what we're seeing, and we think that they could benefit from OmniFlow with you, maybe, thinking through that. Just give me a couple quick examples of maybe how your OTs have been using, and I know we had a little quote from them, and also maybe if you guys are involved in some of that planning during like a lunch hour or a rehab meeting.
Yeah, so we either have weekly meetings, bi-weekly meetings. It kind of just depends how our schedule is going that day. So during those meetings, we look at the patient's history and kind of just develop a plan of care plan altogether, I would say, to just talk about it outside of the treatment sessions too, if we're not picking up the patient, if they're not going to benefit from their speech therapy.
Or on initial eval, if we think this person would be great to utilize the OmniFlow with, we just can't do anything speech related. We can catch the OT that day and be like, hey, we have this new person. We think they are cognitively appropriate to use the OmniFlow, and then talk it out with them that way and help them, kind of have an understanding of that new patient and where they can go with it to utilize it in their treatment. As far as what they're doing with OmniFlow in their treatment, oftentimes I see they'll have it in the gym with them, and they'll kind of use it maybe do some exercises, do some functional daily tasks. And then if the person is feeling a little overwhelmed or something by that, then they can sit down, get on the OmniFlow, get that good breathing going.
No, that's great. That's incredible to hear. And I think there's a couple of takeaways from that. Number one, that we always should take a holistic approach to our patients. For us, we're primarily treating diaphragm and up, right? Where we think of OT and PT treating, lower body and upper extremities. And although that's the case, it's still the same person, right? So taking that holistic approach can be huge, especially when it comes to breathing therapy. That benefits every area, not just cognition, not just speech, not just swallowing, but also, like you said, the ability to complete, dressing, bathing, gait training, exercise. And that all gets the patient to their goals and hopefully back home or whatever, their plan of care is for discharge that much faster. So I think, kudos to you all for talking from an IDT standpoint and sharing that information, and also, being champions for OmniFlow. It's great to hear from you. Thank you.
Thank you.
So Kelly, I'm just going to wrap us up. If you want to put it to the next slide, we'll just kind of tie all of this together. Now, hopefully you have a little bit better idea of what the OmniFlow breathing therapy biofeedback system has as its components and how we might use that for our therapy sessions. So just a couple things. We'll start with the first column here. What is a recap of some of these benefits? Absolutely the fact that we have the interactive exercise visualizations. This is what's going to really benefit your patients. So just as you're hearing from Mandy and Amber, their experience is not unique in the sense that research would agree having virtual reality biofeedback can be greatly impactful for multiple types of therapy, limb therapy, swallowing therapy, cognitive therapy. All of this motor planning really is put into practice when your patients have a way to visualize that. Without some type of feedback, they're only going to have this intrinsic feedback. And if they have an injury to the system, they may not be getting the right feedback. So, us providing some type of external, that might be verbal feedback, that might be a mirror, it could be something like virtual reality visualizations, can provide that motor learning from an extrinsic standpoint. So this is huge for our patients. It's huge for us because we know, how the patient's completing this particular exercise. In this case, it's breathing therapy. We also know from specific breathing therapy, as I mentioned during the overview and demo, that patients do participate at higher levels and greater intensities when we have that virtual reality feedback. You heard Mandy and Amber say it, their patients feel like they're playing a game almost. And not to say that to kind of dumb down the system, but to say it in the sense that it's engaging, it brings out that competitive nature, and the patient can hopefully have a little bit of fun in therapy as well. Yeah, so one of the other benefits is the portability and the touchscreen navigation. So you heard that again from Mandy and Amber. Again, in the infection control world right now that we live in, this is so nice so that we don't have a huge device with lots of components that's just very difficult to be able to properly clean. And then you may not feel comfortable using that again for a different patient in the same day. This is super simple. We have different materials where, of course, you can wipe down all the components. We have a lot of disposables, so you're not reusing it to keep it very clean. In addition to the fact that we have barrier film and other materials that can just keep the whole laptop, the airflow sensor, everything, in that infection control arena for your patients. Certainly, it makes it easier to transport from discipline to discipline. Maybe you're going from a patient room back to the gym. If you have, just like Mandy and Amber's site, although they're primarily working on the top floor, if you have a site that's multi-level, this could be, easier to, jump on the elevator with your laptop and be able to take it down to the next floor. If you're someone who's in home health, or maybe you're in an acute care setting in a hospital, right? You aren't really able to take a huge unit somewhere with you. So this small, it's just a Lenovo ThinkPad laptop to take it in with you to these particular settings can certainly be a game changer. And then lastly, as we look at this, what is valuable to us? Getting the ability to track this data, and that is exactly what Mandy and Amber said. And I can speak from an SLP standpoint as well, that pretty much every area that we rehabilitate, you cannot see and feel. So swallowing, breathing, cognition, we really need something that's able to give us information. So there's that biofeedback tool and can help to track those outcomes so that we know better how to not waste resources and we can get that patient better and hopefully quicker. That's what it's about, is finding those outcomes for the patient. What are their goals? Helping them achieve that quicker. So certainly this can help, as your facility maybe is looking at this, to say that you're featuring this premier biofeedback breathing system. This could be something that can help with census development as well as caseload development with your therapist. Maybe there have been some, Part B patients or some insurance patients within the facility that are more long-term care, if you're in a skilled nursing facility setting, who previously were not able to make great progress in therapy, but now you can go back and hopefully work with that patient now that you have new technology, new protocols, and see some difference. Certainly as you're getting those short-term rehab patients in, that again, hopefully we can get them better and quicker. And the fact that this really works from an integrated standpoint, as I mentioned before, this is something that speech, PT, OT, and nursing can all utilize. So it really just keeps the emphasis on that holistic approach. And hopefully we're able to cut some of our costs down associated with things like modified diets, recidivism, going back to the hospital. If we are keeping that patient more healthy and getting up and moving because now they have decreased pain and anxiety, as well as the fact that they're breathing better. Again, this just helps our whole healthcare system as well as the patient. So Dave, I'm going to turn it back over to you.
Thank you so much, Valerie. Thank you, Amanda and Amber. I hope you saw in the chat, everyone is very appreciative that you shared your testimonials and how you're working with your patients to improve their outcomes. Thank you, Valerie, for the demo and covering the benefits of this groundbreaking OmniFlow